I'd like to share some information for parents that are concerned that their child might have a tongue tie. Now, this is a very legitimate concern because in a recent study done by Children's Hospital of Philadelphia, over 5% of babies are actually impacted by a tongue tie. But what is a tongue tie exactly? Well, this is when the tissue underneath the tongue, which is called the frenulum, actually does not detach before birth. Now, this can cause a lot of different issues, but today I'll list some of the most common signs and symptoms that there is a tongue tie. The first one would be that there is going to be a lot of difficulty with breastfeeding. In addition to that, the mother will also probably be in a lot of pain because the child is having trouble breastfeeding. As the child gets older, they're also going to have a lot of trouble with their speech sounds, and they'll have what's commonly known as a tongue thrust or a lisp. So this impacts certain sounds such as your S, your Z, your THs, your Ds, and more. So the sound such as in the word so might sound like tho. Even more than that, the child will likely have trouble chewing and swallowing because that limited tongue mobility. And as well as that, they will have trouble sleeping, and it might even cause snoring and sleep apnea. There's many different other things that this could cause, but those are some of the main signs and symptoms that you'll see. But the good news is there are plenty of professionals that you can consult with to address this tongue tie and get the help that you need. One of the first people you'll probably talk to is your pediatrician. The pediatrician will likely refer you to someone who might have a little more expertise in this area, such as a pediatric dentist, a speech-language pathologist, or if your baby's still in the breastfeeding phase, maybe a lactation consultant. So, if you have any other concerns about your child having a tongue tie, don't hesitate to contact one of these professionals and get the help and support that you need.